Chest pain. Just the words themselves can trigger a jolt of fear. It's a primal instinct, really. Our chest houses vital organs, the heart and lungs, responsible for the very breath we take, and the blood that courses through us. Any discomfort in this area immediately raises a red flag, signaling that something might be wrong. This instinctive fear is not without merit. Chest pain can indeed be a harbinger of something serious, demanding immediate medical attention. However, it's crucial to remember that not all chest pain is created equal. Its origins are diverse, ranging from the benign and temporary to the truly life-threatening. Imagine a spectrum. On one end, we have muscle soreness, a nuisance easily remedied. On the other end lies a heart attack, a critical event requiring immediate intervention. Most often, chest pain falls somewhere in between these extremes. That's why understanding the nuances of chest pain is paramount. By learning to recognize different types of chest pain, their associated symptoms, and potential causes, we empower ourselves to make informed decisions about our health. This knowledge allows us to approach chest pain with a sense of clarity rather than succumbing to paralyzing fear. Let's begin by acknowledging the elephant in the room, the heart. When we think of chest pain, the heart immediately springs to mind, and rightfully so. Heart conditions, particularly heart attacks, are a leading cause of death worldwide. A heart attack occurs when blood flow to the heart muscle is blocked, often by a blood clot in a coronary artery. The resulting pain is often described as crushing pressure, tightness, or a squeezing sensation in the chest. It can radiate to the arms, jaw, back, or stomach. However, not all heart-related chest pain signals a heart attack. Angina, for instance, is another cardiac condition that causes chest discomfort. Angina occurs when the heart muscle doesn't receive enough oxygen-rich blood, often due to narrowed arteries. The pain, often described as pressure or tightness, is typically triggered by physical exertion or emotional stress and subsides with rest. Understanding the difference between these two conditions is crucial. While both warrant medical attention, a heart attack is a medical emergency requiring immediate intervention. Recognizing the specific characteristics of your chest pain can be life-saving. Now, let's venture beyond the heart. As we've established, not all chest pain originates from cardiac issues. In fact, a wide range of other conditions can manifest as discomfort in the chest area. Think of your body as a complex machine, each organ and system interconnected. Problems in one area can sometimes trigger a cascade of effects felt elsewhere. Musculoskeletal issues, for instance, are notorious for mimicking cardiac chest pain. A pulled muscle, rib fracture, or inflammation of the cartilage connecting the ribs to the breastbone can all produce sharp, stabbing pain that worsens with movement or deep breaths. Then there's the digestive system. Conditions like acid reflux, heartburn, and esophageal spasms can cause burning pain in the chest, often mistaken for heartburn. Even something as simple as a gas bubble trapped in the digestive tract can trigger discomfort. The key takeaway here is this: your body communicates through sensations. Chest pain is just one way it signals that something isn't quite right. By paying close attention to the specific characteristics of your pain, its location, duration, and accompanying symptoms, you gain valuable clues to help differentiate between potential causes. Let's delve deeper into angina, a condition that often causes confusion and anxiety due to its similarities with a heart attack. Imagine your heart as a powerful engine, tirelessly pumping blood throughout your body. This engine, like any other, requires a constant supply of fuel and oxygen to function properly. Angina occurs when the blood flow to the heart muscle becomes restricted, depriving it of the vital oxygen it needs. This restriction is usually caused by a buildup of plaque in the coronary arteries, the blood vessels responsible for supplying the heart with oxygen-rich blood. Think of it like a traffic jam in your arteries, slowing down the flow of blood. This shortage of oxygen triggers a cry for help from your heart, manifesting as chest pain. This pain, often described as a tight, heavy, or squeezing sensation, typically occurs during physical activity or emotional stress when the heart demands more oxygen. It's like your heart is saying, "I need more fuel to keep going." The good news is that angina pain usually subsides with rest or medication, as the heart's demand for oxygen decreases. However, it's crucial to remember that angina is a warning sign. It indicates that your coronary arteries are narrowed and that you're at an increased risk of a heart attack. Beyond angina, other cardiac causes of chest pain. While angina and heart attacks are the most well-known cardiac causes of chest pain, they are not the only culprits. The heart is a complex organ, and several other conditions can lead to discomfort in the chest area. One such condition is pericarditis, an inflammation of the pericardium, the sac that surrounds the heart. Pericarditis can cause sharp, stabbing chest pain that worsens when you lie down or take a deep breath. This pain often feels like it's coming from the center or left side of the chest and may radiate to the neck, shoulder, or back. Another less common but potentially life-threatening condition is aortic dissection, a tear in the inner layer of the aorta, the main artery that carries blood from the heart to the rest of the body. Aortic dissection typically causes a sudden, severe tearing or ripping sensation in the chest that may radiate to the back, abdomen, or neck. Other cardiac conditions that can cause chest pain include myocarditis, which is inflammation of the heart muscle, and coronary artery spasm, a temporary tightening of the coronary arteries. While these conditions are less common than angina and heart attacks, it's crucial to be aware of their existence and seek medical attention if you experience any unusual chest discomfort. The heart attack, a race against time. While we've explored other cardiac causes of chest pain, it's crucial to revisit the heart attack, a medical emergency that demands immediate attention. A heart attack, also known as myocardial infarction, occurs when the blood flow to a part of the heart muscle is completely blocked, leading to the death of heart tissue. Imagine a crucial artery supplying blood to a section of your heart suddenly becoming completely obstructed, like a water hose with a kink in it. The part of the heart muscle deprived of oxygen-rich blood begins to die, and the longer this blockage persists, the greater the damage to the heart. The pain of a heart attack is often described as a crushing pressure, tightness, or a squeezing sensation in the chest that lasts for more than a few minutes. It's often more severe and long-lasting than angina pain, and may not be relieved by rest or medication. The sensation can feel like an elephant sitting on your chest, a feeling of intense pressure that can be terrifying. It's crucial to recognize that time is muscle when it comes to a heart attack. Every minute that passes with a blocked artery increases the risk of permanent heart damage. Recognizing the enemy symptoms that demand action. Knowing the difference between different types of chest pain can be the difference between life and death, particularly when it comes to heart attacks. While chest pain is a hallmark symptom, it's often accompanied by other warning signs that should never be ignored. Shortness of breath is a common accompanying symptom, often described as a feeling of not being able to catch your breath or like you're suffocating. This occurs because the heart, struggling to function properly, can't pump blood efficiently, leading to fluid buildup in the lungs. Sweating, particularly a cold, clammy sweat, is another red flag. This occurs as your body goes into overdrive, trying to compensate for the heart's struggle. Nausea and vomiting are also common, particularly in women, and can be easily mistaken for indigestion. Pain radiating to the arms, particularly the left arm, is another classic symptom, often described as a dull ache or numbness that travels down the arm. Pain may also radiate to the jaw, back, neck, or stomach, making it easy to confuse with other conditions. Remember, any chest pain, especially if it's new, unexplained, or accompanied by any of these warning signs, should never be ignored. Seeking immediate medical attention could save your life or the life of someone you love. When your chest pain isn't your heart, it's important to explore other culprits. The heart is often the first suspect, but it's not always the culprit. Chest pain can originate from the lungs, digestive system, muscles, bones, or even mental state. Recognizing the nuances of your pain helps differentiate causes and seek appropriate treatment. Digestive issues can mimic heart trouble, causing chest pain and anxiety. Heartburn from GERD, peptic ulcers, and even gas bubbles can cause chest pain. Differentiate by noting symptoms. Heart issues often include shortness of breath and sweating. Digestive pain usually involves bloating, belching, and a sour taste. Now, let's shift our focus to another common culprit of chest pain: musculoskeletal issues. The muscles, bones, and cartilage that make up our chest wall are surprisingly prone to injury and inflammation, often leading to pain that mimics cardiac events. Consider, for instance, the excruciating pain of a rib fracture, often caused by a fall, a direct blow to the chest, or even severe coughing. This pain, sharp and stabbing in nature, intensifies with deep breaths, coughing, or movements that put pressure on the fractured rib. Costochondritis, an inflammation of the cartilage that connects the ribs to the breastbone, is another common musculoskeletal cause of chest pain. This condition, often triggered by strenuous activity, heavy lifting, or even a persistent cough, causes a sharp, aching pain in the rib cage that worsens with movement or deep breaths. Muscle strains, particularly in the chest wall muscles, are another frequent offender. These strains, often caused by overuse, improper lifting techniques, or even a sudden twisting motion, can cause a dull, aching pain that worsens with movement or when the affected muscle is engaged. While musculoskeletal chest pain is generally less concerning than cardiac pain, it's crucial to remember that severe cases can be debilitating. Moreover, the location and intensity of musculoskeletal pain can sometimes mimic heart attack symptoms, leading to unnecessary anxiety and medical consultations. Section 4. Don't let anxiety fool you. Understanding panic attacks and chest pain. Anxiety can cause chest pain, often mimicking heart attack symptoms. Panic attacks trigger physical symptoms like chest pain, rapid heartbeat, and dizziness. Differentiating between panic and heart attacks is crucial. Panic attack pain is sharp and short-lived, while heart attack pain is intense and longer-lasting. Section 1. The Mind-Body Connection: How Stress Affects the Chest. Stress isn't just a feeling, it's a physiological response impacting every system in our body. When stressed, your heart races, blood pressure rises, and muscles tense, mimicking serious cardiac conditions. Chronic stress can lead to inflammation, muscle tension, and changes in heart rhythm, contributing to chest pain. Think of your chest as a pressure cooker, with stress as the heat building beneath the lid. Section 2. Beyond the physical anxiety's grip on chest pain. Anxiety often manifests as tightness or pressure in the chest, a feeling of impending doom. This can lead to hyperventilation, causing chest tightness, tingling, and muscle spasms, mimicking heart attack symptoms. Anxiety heightens awareness of bodily sensations, turning minor aches into full-blown anxiety spirals. This heightened awareness exacerbates chest pain, making it difficult to distinguish from serious conditions. If anxiety is the simmering pot of worry, then a panic attack is the pot boiling over. Imagine a wave of terror washing over you, with heart pounding, shallow breaths, and crushing chest pressure. You might feel dizzy, detached from reality, and overwhelmed by fear. Chest pain during a panic attack is often sharp, stabbing, or crushing, making it hard to distinguish from a heart attack. This intense experience often leads to seeking emergency medical attention. Understanding the link between anxiety, panic attacks, and chest pain is crucial. Managing anxiety is key to finding lasting relief from chest pain. Relaxation techniques like deep breathing, meditation, and yoga can calm the nervous system. Cognitive behavioral therapy, CBT, helps identify and change negative thought patterns. Lifestyle modifications, such as regular exercise and a healthy diet, also reduce anxiety and promote well-being. We've explored various causes of chest pain, from heart attacks to anxiety. Learning to differentiate between these causes is crucial. The nature, location, and duration of the pain, along with accompanying symptoms, provide valuable clues. Crushing pressure suggests a heart attack, while sharp stabbing pain might indicate a pulled muscle. By paying attention to these characteristics, you can better understand the origin of your chest pain. Section 2, Location, Deciphering chest pain patterns. The location of chest pain can provide crucial clues about its cause. Heart-related pain often radiates to the left arm, jaw, or back. Esophageal pain manifests as a burning sensation behind the breastbone, radiating upwards. Musculoskeletal pain is localized and worsens with movement or pressure. Section 3. Beyond the ache, unmasking accompanying symptoms. Accompanying symptoms often hold the key to understanding chest pain. Heart attack signs include shortness of breath, cold sweats, nausea, and a sense of impending doom. Anxiety-induced pain comes with a racing heart, dizziness, and tingling sensations. Digestive issues like heartburn cause burning chest pain, bloating, and a sour taste. This journey is about empowering you to make informed health decisions. If chest pain is new, unexplained, or accompanied by concerning symptoms, seek medical attention. Trust your instincts and call emergency services if something feels wrong. Time is crucial for conditions like heart attacks. Delaying can have serious consequences. Always err on the side of caution when it comes to your health. Navigating chest pain can feel daunting, but knowledge empowers us. Understanding the causes of chest pain helps us make sense of our body's signals. We become active participants in our health, recognizing patterns and seeking appropriate care. This knowledge replaces panic with informed action, guiding us through the complexities of chest pain. We can now approach chest pain with confidence, equipped to make informed decisions. Our bodies constantly communicate with us, sending subtle signals. Subtle aches and discomforts can be early warning signs of health issues. Chest pain is often a signal that something requires attention. Tuning into these signals can lead to early detection and intervention. Paying attention to subtle discomforts can help diagnose and treat conditions early. Let's shift focus to a proactive approach to heart health. Prioritize cardiovascular well-being to reduce the risk of heart disease. A heart-healthy diet and regular exercise support optimal heart function. Managing stress through relaxation techniques benefits both mind and heart. Quitting smoking is the most important step to improve heart health. Total word count, 1108 words.